Today, we're going to talk about some things that we've overheard in Belmont Cragin about the COVID-19 vaccine. One question we've heard a lot is, do I really need a second dose of the COVID-19 vaccine? The answer is yes. So while some protection is achieved after just one dose of the Pfizer and Moderna mRNA vaccines, this protection is much less than someone would get after 2 doses. The second dose of Pfizer or Moderna acts as a booster shot, better preparing our immune system to fight off any COVID-19 infection that could get into our bodies. All people should receive 2 doses of these Pfizer and Moderna vaccines. Another thing we've overheard in Belmont Cragin, people are concerned if the vaccine will alter their DNA. Will it change the DNA in their body? Will this turn them into a zombie? The good news is no, this is not correct. The COVID-19 vaccines that are available to us are designed to train our body's immune systems to fight the coronavirus. The messenger RNA technology used in the Pfizer and Moderna vaccines teaches our immune system to fight against COVID-19, and it does this without ever touching our DNA. Once the mRNA vaccine teaches our immune system how to fight off the COVID-19, it dissolves without ever affecting our DNA. Another thing we've overheard is the question, if I already had COVID, do I still need to get the vaccine? The answer is yes. Belmont Cragin had very high COVID-19 rates, and while many of us had it, the CDC, the Centers for Disease Control, recommends that people who have had COVID-19 still get vaccinated. This is because of the severe health risks that are associated with COVID-19 and the fact that even once we're vaccinated, it's still possible to get infected. People who were treated for COVID-19 with monoclonal antibodies or convalescent plasma should wait 90 days before getting a COVID-19 vaccine. If you're not sure if you got these treatments, ask whoever treated you in the hospital for COVID-19. These 2 treatments, monoclonal antibodies and convalescent plasma, are only treatments that were given to people who were hospitalized for COVID-19. If you're not sure if you've had them, again, check with your doctor. Will the vaccine infect me with COVID-19? No, it is not possible to get COVID-19 from the vaccines. Vaccines against SARS-CoV-2, which is just another name for COVID-19, use inactivated or dead virus or tiny parts of the virus or a small piece of genetics from the virus. None of these can cause a COVID-19 illness. Another thing we've heard is, after I get the vaccine, do I still need to wear a mask? Yes, until we drastically reduce the person-to-person spread of COVID-19, and until we see very few hospitalizations and deaths, we still need to wear masks and practice physical and social distancing even after we get vaccinated. Another thing we overhear in the neighborhood is, my uncle thinks the vaccine is unsafe and will put a government chip in him. The good news is this is not correct. Maybe it's your father, sister, cousin, but we all have someone in our family who is hesitant to receive the vaccine, sometimes for outlandish or silly reasons. Here's a few things to show or tell a family member who is hesitant about getting the COVID vaccine. And no, there's no government chip involved. Number 1, it's safe. Based on clinical trials, this is all the testing for the vaccines that involved more than 70,000 people. The first 2 vaccines, Pfizer and Moderna, were shown to be extremely effective at preventing COVID-19. Pfizer is 95% effective against preventing COVID-19, and Moderna is 94.1% effective against preventing COVID-19. These clinical trials were conducted on a diverse group of participants, including people of Asian, Black, Hispanic or Latinx descent, and Native American descent. 2, it is important to get the vaccine even if you've had COVID-19. While getting sick from COVID may offer some amount of natural immune system protection or readiness and training for your body to fight off COVID-19, the risk of severe illness or even death from COVID-19 is so much greater than the possible benefits of natural immunity that you get from actually getting the real coronavirus. Getting a COVID-19 vaccine will help protect you without you having to be sick with the virus yourself. Number 3, Side effects are normal, but talk to your doctor if you have severe reaction concerns. Side effects after getting a COVID-19 vaccine are normal signs that your body is building protection against the virus. It is training your body to be able to fight the COVID-19 illness if the real thing gets into your body later. Side effects may even feel like the flu, but they should go away in a few days. According to the CDC, anyone who has a severe allergy, also called anaphylaxis, to any of the vaccine ingredients should not receive this vaccine. The CDC says people with allergies to normal things like food, insects, latex, and other common allergens like seasonal allergies can safely receive the COVID-19 vaccine and should do so. Those with a history of severe allergic reactions to injectables or other vaccines should discuss their vaccination with their doctor, and your doctor can evaluate whether or not getting the COVID-19 vaccine is right for you. There are also some concerns about the cost of the vaccine. Here's some really important things to remember. COVID-19 vaccine providers cannot charge you for the vaccine. They cannot charge you any administration fees, co-pays, or co-insurance charges. They can't deny vaccination to anyone who does not have health insurance, is underinsured, or is out of network at that provider. They can't charge an office visit fee to the recipient of the vaccine if the only service provided is a COVID-19 vaccine. They also can't require additional services in order for a person to receive their COVID-19 vaccine. However, if someone needs other treatment and care on the same day that they're getting their COVID-19 vaccine, the doctor's office may charge a fee for those other medical treatments. Thank you for listening today, and stay well.